You like wearing high heels, they make your leg look nice, you feel sexy, but do you know that there's hidden damages that high heels can cause throughout your body? We're going to talk about some pathologies that can be created by the use of heels, what compensation your body does to adjust to the heels, and stay until the end because we're going to discuss what type of heels you should wear if you still want to continue to use them. You can do that the smart way. Let's go! Hi, I'm Dr. Blanchette.
And I'm Dr. Richard.
We're both board-certified podiatrists and foot and ankle surgeons. And today we want to dive into the science behind high heels. They are very popular, but they can do a lot of wrong on your body. We're going to talk about how they can affect not only your feet, your ankles, but also your legs, your knee, your lower back, even your neck.
Your body wasn't designed for that.
Let's start with how your body is designed to work. On each feet, you have 3 points of contact with the ground. You have the heel, the base of the big toe, and the base of the little toe. It forms a stable tripod.
This tripod allows your body to maintain stability, but also to distribute the forces throughout your foot. But once you put a high heel, everything changes. Now your center of gravity is moving forward, and instead of your weight being distributed evenly, now there's tremendous pressure on your forefoot. Higher the heel, higher the pressure.
And at the same time, your contact with the ground becomes so much smaller, especially if you're wearing stiletto type of heels. Instead of being on a broader surface, now you're trying to balance on very tiny little points, and this decreases your stability tremendously. Why high heels cause so many injuries?
The loss of stability explains why high heels create so many injuries. In my practice, I've seen as much ankle sprain in my patient who do a lot of sports like basketball than in my patient who wear high heels. High heels is an extreme sport.
It is.
Large biomechanical studies shows that high heels significantly impair both static balance, that's your stand still, and dynamic balance, that means when you're walking. So every step requires your muscle to work harder just to keep you upright.
And think now about walking on cobblestone, on grass, on a boardwalk. This is going to be so much more unstable and the risk of injury is increased dramatically. And then also oftentimes we wear our heels when we go out. There's a little bit of alcohol. If you're inebriated plus a unstable balance is a perfect mix for a very bad injury, which we have seen too many times in our practices.
Yes, and those injuries are not only minor. We've seen ankle fractures from wearing high heels, metatarsal fracture, high ankle sprains, so it's not to take lightly. What happens in your shoes?
So you have your high heels, you're lifted forward, gravity brings your feet more forward and your toes get squished into the narrow toe box. That can cause a lot of problems that we're just gonna go over very soon. But if we're talking about just the skin level, this causes a lot of rubbing. You can have blisters, you can have corns, you can have calluses. There's really not a lot of room in the toe box. Now you're squishing all of those piggies in there and it causes a lot of discomfort.
These are temporary problems, but high heels can also cause permanent damage to your feet. So let's go over the pathologies we see with high heels.
Number 1, bunions.
One of the best known problems caused by high heels are bunion. The medical term is hallux abducto valgus, and it's when your big toe slowly shifts towards your second toe. Meanwhile, the first metatarsal bone moves inside of your foot. So that creates a big bump in the inside of your foot. And your joint is malaligned every step you take. That makes sense that the research consistently shows that wearing high heels, especially the ones with narrow toe box, can cause bunion formation.
Another issue that happens with high heels, as we mentioned earlier, you're standing up like this. There's some people that have much more flexible feet than others. So if they have a lot of flexibility at the foot, you put a high heel, this first metatarsal becomes even more lazy. I don't know if you remember our lazy metatarsal from other videos, but now you're putting a lazy first metatarsal in charge, and it's just like, I'm not doing that. So then basically it starts to lift up even more, which creates instability of this joint here at the tarso-metatarsal joint. And this is what is supposed to be strong and straight in order to have a nice straight toe. So this one becomes unstable, starts to shift out this way. This one just follows along and then stays with the lesser toes and causes the deformity.
Unfortunately, bunions are problems that progress over time. That means they're gonna get worse and worse. So they can be a little achy at first. Then you start to have more sharp pain. The bump might become bigger. You might get inflammation, and it can even lead to arthritis.
If you want to learn more about bunion, please let us know in the comment down below so we can make a whole other video on bunions. We haven't covered bunions yet, right?
No, I know. Number 2, sesamoiditis.
On the bottom of the big toe, there are 2 little bones. They're called sesamoids. I describe them to my patient as the kneecap of the big toe. They're on the bottom of their feet. They're normal. We also have them in the thumb. But picture this. Now you are in your high heels and all of your pressure is over here on those 2 little bones. So that can cause a lot of inflammation. And this is called sesamoiditis. This is when the sesamoid bones are inflamed. And if you continue to do that over time, sometimes you can even get a stress fracture in the sesamoids. I think you've had a few patients recently.
Yeah.
With this problem, right?
Yeah. Unfortunately, I've seen multiple patients having stress fracture, especially because they were working in high heels for over 10 hours. Boom, the bone cannot withstand the pressure and there's a crack in the cortex.
This is seen even more commonly in people that have a high arch foot, because when they have a high arch foot, their foot is already like this. So just on a regular basis, even walking barefoot on the ground, they have more pressure going at the sesamoid. So now you do this and then you're adding a high heels. There's just tremendous pressure that goes on those 2 little bones, and at some point they can't withstand the pressure and they start hurting. And if you ignore it, they can even develop a fracture. Number 3, Tailor's bunion.
So I'm sorry, but you can also have a bunion on the outside of your foot. It's called bunionette or Tailor's bunion. And this one is when your pinky toe goes toward your 4th toe and your 5th metatarsal goes outward. So now you have a bump on the outside of your foot.
The mechanics of this happening is similar to the one on the bunion, because like we said earlier, with the tripod, you usually have pressure on the heel, 1st and 5th metatarsal heads. And now by putting a lot of pressure, yes, you're putting pressure on the 1st metatarsal head, but also on the 5th one, and it becomes unstable. This one doesn't move much because there's a metal wire in between, but basically this becomes unstable and it starts to shift out this way with the pinky toe joining its other friends on the side here, creating a bump on the side, which can rub and cause a lot of problems or a lot of irritation like blisters and things like that.
Number 4, hammertoes.
Hammertoes are when your toes are not straight anymore. Instead of being straight, they are bent. There's many different types of hammertoes and we can go over that in a different video. If you want to, let us know in the comment down below. But basically what happens is that because of the gravity pushing your foot down, the narrow toe box, your toes become unstable and they start to bend out of shape. One of the reasons that happens is because there is an imbalance between the long muscle of the leg and the short muscles that are on the foot itself because of the position of the foot. Because of the narrow toe box, the toes are forced in that position also inside of that tiny little toe box, and they have to bend out of place to fit those narrow shoes.
And eventually, those toes can become permanently bent, and we call that hammertoes. Early on, it's usually a flexible deformity, but they can definitely become more rigid over time. And of course, rigid hammertoes come with way more problems. They can get more corn, even ulcers at the top of the toe when you wear any type of shoes, not only heels, and you get a lot of retrograde pressure on the head of the metatarsal. You can develop metatarsalgia, plantar plate tears, or even like deep corns over there. We made a video on the deep submetatarsal corn right there.
Another thing that can happen is corns in between the toes. They can be very, very painful. If you look at the toes, they have a wide portion at the base, narrow here, wide again. And the wide and the narrow of one toe is supposed to go with the other one of the other toe, so there's no rubbing. But when it starts to bend down, so now 2 of the wide portion can rub together and the skin is squished in between and causes more skin because of the pressure, which leads to a cord, and it is so painful. It's literally like tipping a pebble between your toes and squishing your toes together.
On this channel, we share evidence-based medicine to keep your feet healthy and looking their best. We also share tips and tricks that you can add to your daily life, and also brands and products that we like, but also that our patients have tried and liked all over the years. So if any of this interests you, please subscribe to the channel.
Number 5, Morton's neuroma.
Another common conditions that we see with high heels is Morton's neuroma. This is an irritated nerve, and you can feel like you have a rolled sock on the ball of your shoe when there's nothing there. You can even have sharp shooting pain going down your foot and even up your foot. So the Morton's neuroma is specifically in the third interspace. Anatomically, it's more common to have it over there because two nerves join there together, but it can be in each and every interspace. They just have a different name. So not only your toes are squeezed inside a narrow-toed box inside the high heels, your metatarsal heads also are squeezed, and then it squeezes the nerve that is right in between the metatarsal heads.
When you're wearing heels, your toes are bent up this way. The nerve is located at the bottom here, in between the third and the fourth metatarsal heads. There is a ligament that is right on the top. It's called the DTML, the deep transverse metatarsal ligament. So let's say in this case here, it would be this yellow piece that you see over there. So if you're just flat-footed like this, there's not as much pressure in between. But if you are going like this, now that DTML is pushing against that nerve that is now squeezed between the DTML and the ground, and it causes a lot of compression, pain, and irritation, which makes the neuroma so much worse.
Number 6, Achilles tendon shortening.
So it makes a lot of sense, right? That if you are always using something that is like this and your foot is up, your gastrocnemius muscle, soleus muscle, and your Achilles tendon is gonna be shorter. If you continue to do that over time, well, this shortening can become permanent. And this is called equinus deformity.
Research show that people who wear high heels higher than 2 inches for several hours and several years, they develop shorter calf muscle fibers and tighter Achilles tendon. This isn't just tightness, it's an actual anatomical change.
And what happens with equinus is that it puts a lot more pressure at the front of the foot, on the bottom of the foot. So that can lead to plantar fasciitis, that can lead to metatarsalgia, an increased risk of Achilles tendon rupture, increased risk of bone spurs. So this is really not a fun thing to have.
Yeah, and patients who wore heels for years and years and years and have a short Achilles tendon will actually tell you that they cannot wear flat shoes or sneaker or wear barefoot. They are more comfortable now in high heels because of that shortened Achilles tendon.
But the problem is that now they cannot wear anything that's flat, so they always have to wear some type of heel, which always causes a lot of pressure at the front of the foot. So now they are left with issues at the forefoot here, and some of the other issues that we just described above.
Yeah, a vicious cycle.
It is, truly.
Postural changes.
So now let's move a little bit above the foot, because feet are our foundation. So if the foundation is different, everything else above is gonna change as well to kind of compensate for the changes that happen down there.
When you wear heels, your center of gravity moves forward. So your whole body postural chain needs to adapt to stay upright and keep its balance. Now let's start with the knees.
When you're standing up with your heels, as we mentioned, we're a little bit forward. What will the knees do? They will bend. So they're gonna bend slightly to bring your center of gravity more back to have everything centered with your feet.
Biomechanical studies shows that wearing heels increase the pressure in the inside of your knees. So of course, if you wear those for many years, that can contribute to early development of knee osteoarthritis.
Now let's move on to the next joint, which are the hips. So there's gonna be some forward motion of the pelvis at the hip joint, once again to balance the center of gravity. And what happens is that it tilts the pelvis forward, which is gonna cause also some problem in the lower back.
Definitely, and having the pelvis that tilts forward will also tighten your hip flexor muscle. So a lot of patient complaints about that. Now it's time to move to the lower back. Yes, wearing heels will increase your lordosis. That means the curve in your lower back. A lot of people like that because it shows off your attributes, but it's very bad for your biomechanics.
It's gonna create additional stress in the lumbar spine and can cause a lot of problem down the line, especially if you're wearing heels for many years. Another thing that happens that with heels, there's really not a lot of shock absorbing. All the pressure goes through your heel and then boom, directly up your spine, up your leg, up your knees. A lot of tension and stress up the chain.
And the compensation doesn't stop there. You can also have compensation in your upper back and neck. Wearing heels indirectly increase the cervical lordosis. Once again, it's that extra curve within the back of your neck. And think about it, if there's an extra curve, all the muscle will have to overwork and you might have more tightness over there.
What to look for in heels?
After hearing this video, you might be, okay, should I throw all my heels away? I know we just highlighted the negative points of heels, but we're also realistic, right? We're women, we're gonna wear heels here and there. So now let's go over what to look for in a good pair of heels.
Our goal is not to eliminate heels completely. You can still wear them, but you have to do it the smart way. The medical literature is giving us some guidelines. What we recommend is to use heels that are not higher than 5 centimeters or 2 inches, because higher than this is gonna cause even more of those problems that we discussed about earlier.
That means our kitten heels are good. You can also look for platform heels, meaning that the sole of the forefoot is thicker, so the difference with the heel and the forefoot will be reduced. So the heels look higher overall, but the difference between the forefoot and the heel is only 2 inches.
Another thing to look at is the width of the heel itself. A block heel is gonna be a lot more stable because all of your weight is gonna be on a bigger surface area compared to something that's much smaller. We also have to look at the front of the foot. Pointy heels are gonna cram your toes in there. So you can have something that's a little bit more rounded, a little bit more anatomic to your foot. And also the type of material. So a stretchy material is gonna be better to decrease the pressure on your toes.
If you do wanna wear a pointed toe box for the style, there are some brands that give different width variety. So of course, if you go with an extra width, it will help. Another thing to look for in the toe box is the depth. So if the depth of the toe box is really small, your toes are gonna be even more crammed versus if you have a deeper toe box. And then the sole is another point. Some sole have some shock absorption and some cushioning that will also make it better for you.
Even some of them have a little bit of an arch support that pats the arch a little bit more, and that makes it better. And also more cushion at the front of the foot can be helpful.
What the arch does is, remember at the beginning that we mentioned that the center of gravity moves forward, so there's more pressure in the forefoot. By adding an arch, it helps redistribute the pressure away from the forefoot and more towards the arch area.
And then, of course, the time that you're gonna be wearing your heels matters. In the office, I often mention to my patient that heels are not great for your feet, as we just discovered in this video. But let's say if you have a wedding to go to, an event, something you want to look cute, go ahead, wear your heels. Maybe also pack a little bag with some flats. So if your feet start to hurt, you can switch and put another shoe that's going to decrease the pressure on your feet.
This is so smart. I give the same recommendation. And an added tip, if you wear a maxi dress, a dress that go all the way down to the floor, nobody will know you're wearing flats or sneakers under there. Studies suggest that tissue strain and discomfort increase significantly after 3.5 hours of wear. So once again, maybe if you're on vacation, wear your heels for dinner, but not to explore the whole city.
Same thing also for people that are going to work, right? So commuting to work, you should be wearing a good walking shoe and then just bring your heels in a bag, or even better, you can leave them at the office and then just slip into your shoes in the office.
Nobody will know. Okay, that's a wrap. If you remember 3 things from today's video, remember these. Number 1, long-term wear of high heels can contribute to bunions, hammertoes, neuromas, and Achilles shortening or tightness.
And we see this in the office all the time. Number 2, high heels don't just affect your feet. Your feet are the foundation of your body, and if they are not placed in the appropriate alignment, everything up is gonna suffer, from your knees, your hips, your lower back, even your neck.
Number 3, the higher the heels and the longer you wear it, the greater stress is placed on your body and joints.
Today we briefly talked about what to look for in heels, but you know there's a bunch of things that you can buy online to put in your heels to make them more comfortable. There's also some brands that are better than others, so stay tuned because in one of our next video we're gonna go over all of that to keep your feet healthy and comfortable.
Wearing heels create so much pressure in your forefoot, and we see it all the time. Patient complaining of callus underneath their metatarsal head. The most common ones are the 5th metatarsal head. If it's you, go look at this video over there. But you can also have 2nd metatarsal head callus. Look at this video here. You'll know all the root cause and how to treat it once and for all.
Okay, see you next week.
Bye!